Hi there, my name is Paul Furlong. I'm the Creative Director at Opus Media, and today I'm joined by Dr Penny Trayner. She's a paediatric clinical neuropsychologist and chartered psychologist, and also the founder of Goal Manager. So welcome, Dr Penny.
Hi Paul, how are you doing?
So tell me, Dr Penny, a little bit about your clinical background.
Okay, so as you said at the start there, I am a clinical psychologist by trade, but for the last 11 years, I have specialised in neuropsychology. I'm now a clinical neuropsychologist, and I provide community-based rehabilitation services for children who have had acquired brain injuries, and we provide services all over the UK.
So tell me a little bit about the difficulties that you found in managing that caseload.
So working all over the UK and also having responsibility in all the multidisciplinary teams that I worked in for managing all of their goals, reporting on team activity and making sure things were running as efficiently as possible was becoming a hugely onerous task. I was finding that I was having to travel all over the country to team meetings, spending a lot of time trying to get data from people and analyze it and bring it all together to make sense of it. And it was huge, it was onerous, and it took away a huge amount of time that could be better spent on seeing patients and on clinical activity.
All of this time that was taken away from delivering clinical interventions, what was the impact on the patients?
Yeah, so ultimately, if people aren't going to receive the rehabilitation that they need at the time when they need it, and in the most and at the doses that they need it, it's going to have an impact on their long-term recovery. So we know that the outcomes linked to rehabilitation can have a huge impact on the person's quality of life, their ability to return to work, their ability to return to school, how well they progress in education, their lives, their relationships. All of these can be impacted by poor outcome following acquired brain injury.
So what did you decide to do about it?
So we look for a tech solution. So we have developed a software, Goal Manager. So Goal Manager is designed to coordinate, analyze, sort, and report on all of the team's goal data, their objectives, all the activity that they're doing towards a person's rehabilitation. It takes all of that information, it analyzes it, organizes it, and allows it to be presented in a way that is meaningful, not only for the team, but also for patients. And it also can be accessed from anywhere, in the country, in the world. So it means that teams can be working remotely wherever they are in the country, which obviously at the moment is something that's very, very important. But as I say, it was something that actually we had previously identified as being a problem and is an ongoing need, particularly in rehabilitation, but also in other types of health services.
And so what impact is this having on the patients now that you can kind of consolidate all of this information and work remotely?
Yeah, so we did some study, some analysis of how much time we were saving, and we tracked team data for a multidisciplinary team around a patient and found that across a 6-month period, you could save around 43% of time. That was a huge amount of time that we were getting back that we're now able to put into that clinical activity. The cost savings for teams are huge. Obviously, there's always costs associated with time, but most importantly, there is more time available to work on what is actually important for the patient, which is delivering the actual rehabilitation. So they're getting more rehabilitation, which means they're going to hopefully have better outcomes in the longer term.
That's amazing, Penny. Sounds like an amazing product, an amazing service that you're now able to give more time to the patients and see some incredible outcomes for the patients. Thank you for sharing with us today.
That's great. Thank you, Paul.